Well, it looks like it's 6 o'clock, so maybe I'll get us rolling. I just want to welcome everybody to the Zoom panel discussion that we have entitled Managing Mental Health in the Era of COVID-19. I am Dr. Tim Osberg. I'm a professor of psychology at Niagara University, and I'm also a licensed psychologist. And I would like to introduce my co-moderator, Dr. Shannon Hodges, to introduce himself.
Yeah, thanks, Tim. As Tim said, I'm Dr. Shannon Hodges. I'm professor of clinical mental health counseling at Niagara University, licensed mental health counselor, 2.5 decades of counseling experience. And I'm very pleased to be here tonight with Dr. Osberg, my colleague and friend, and our wonderful former students and now professionals out in the field and everybody else. I'm a part of, Tim and I are doing this as part of Niagara University's mental health. So happy to be here.
Well, thank you, Shannon. First, I would, before we carry on, I would like to thank my colleagues on the Mental Health Literacy Committee who are responsible for this week-long series of activities and trainings that are going to really up Niagara's mental health literacy going forward for years to come. And those committee members include, first of all, our illustrious chairperson, whom I can see here on board with our talk, Patty Roble. Patty is just tireless, firing off emails at all hour of the day and night, getting this week off the ground, and I want to thank her for that. And the rest of our committee, Fran Crosby, Brittany, who you met just a little while ago, who's our brains behind the scene for IT purposes tonight, Lynette Stewart, and Shannon Stott are the other members of the committee. So I want to just thank them for helping put all of these activities together. And including this talk tonight. Our format will be a panel discussion. Dr. Hodges and I will make a few opening comments before we turn to our panel. Then each of the panelists will present in succession, followed by a question and answer period after that. And Brittany's going to moderate the questions that pop up through our chat tonight during tonight's talk. So I guess I'll just start us off with some comments, and then I'll turn things over to Dr. Hodges to do so as well. I think we are all aware of the health effects of COVID-19, and I don't think you can be unaware of the mental health effects of COVID-19 because we are seeing about it everywhere. You're seeing it on the nightly news now about the mental health effects. You're seeing it in the newspaper, magazines. I took the liberty to go on Google just an hour or so ago, and I Googled mental health and COVID-19, and there's just a whole flood of articles within just the last few hours and days on the mental health impact of COVID-19. One of those studies was published by the CDC back in late August on data that they had collected in June of this year. And they compared people in the US, a sample of over 5,000 people, with people who had responded to similar questions about mental health back in June of 2019. And just in that 1 year time period during which COVID happened to all of us, here's some statistics for you. Rates of anxiety increased threefold. Rates of depression increased fourfold. Rates of serious suicidal thoughts increased threefold, from about 4% of the population reporting serious suicidal thoughts to now 11%. And that's in June when the weather's nice. More beyond that, I should say, substance abuse has increased 13%, trauma-related symptoms 25%, and the list goes on. And some of the other data that have been reported recently as well include a study from the Lancet, who pointed out that about 1 in 5 people with COVID-19 develop symptoms of mental disorders. Not a shocking statistic to, I think, our professional members of the panel tonight who know that the rates of mental health issues in the population, diagnosable mental health issues, are about 1 in 5 to begin with. But they mentioned that there's a bidirectional association. People who get COVID-19 now are 65% more likely to develop a mental health disorder. In fact, individuals with COVID-19 are likely to develop within the first 3 months. 1 in 5 will develop within the first 3 months of their diagnosis a mental health disorder. So, and the list goes on. College students are vulnerable. Young adults with issues and concerns about job security are increasingly feeling mental health issues. There's a spike in overdoses as a result of COVID-19. These are all articles I've just pulled up from Google recently. So it's definitely a timely talk. Our panelists are going to really provide an important service, I think, to our community in the comments that they're going to have. At this point, I'll turn things over to my colleague, Dr. Shannon Hodges.
Okay, thank you, Tim. I just want to mention a few things. I'm going to start out with just a self-disclosure. In the last 3 weeks, 3 close family members of mine have been diagnosed with COVID-19. And they have all been people who've tried to be careful. And my brother, who's a minister, some people in grief who just lost a loved one who turned out to have COVID, ran up and grabbed him, even though he tries to distance, and he comes down. That fortunately, he's on the mend. His son, my nephew, who lives in Texas, came down with it. His wife is a nurse practitioner, and so he's getting good health care. And I have a niece back in my hometown who also has it. She's very young and recovering well also, but it's all impacted their lives and created a lot of people and a lot of stress. So I'm very acutely aware of it now in a very personal way. Of course, I also know some people who have died from it. So it is a very, very serious illness. And as Tim's talking about, now I've seen some of the statistics that he's talking about. It's definitely been an issue in people's mental health. I just got off a call. I was doing a program in mindfulness-based sleeping for DuVille College psychology department. And I had a number of questions, and they're all talking about this time being so difficult. And so there's a lot of that out there, not just on students, but all the way up. And I looked on just something I would say, I'll be brief, but here's just thinking about some things we can do. And our panelists will talk about this, but look at the American Counseling Association's recommendations. Number one, making sure you get social support. And I prefer the title physical distancing versus social distancing, but I get it. But while you're physical distancing, find ways to safely get social support, either through Zoom talking or calling people, etc. That's going to be very, very important for your own mental health, as well as your own support. And think about those people who live alone. They're particularly vulnerable. For those people who are spiritually inclined people, which are most people, not necessarily religious, a lot of us are, and a lot are spiritual. And even if you're not, part of that is, where does your meaning in life come from? That's going to be of critical importance. So find that. A lot of us, it's through prayer or meditation, or finding those things we can do safely that bring us a sense of meaning. Physical activity is of critical importance. I learned back when I started college, probably one of the adaptive mechanisms I had going was that I was a long distance runner. Now, I'm not any good other than I have good stamina. I'm not too impressive, but I noticed that helped me manage stress. But you don't have to be a runner. You can be a yoga practitioner, you can be a walker, whatever. And it's just basic, 15 minutes of sustained activity just 3 times a week. And if you have difficulty getting outside, the weather's bad, maybe walking around your living room. It doesn't have to be, you don't have to be setting any records, but it's just that movement. There's a clinician in Stanford, Kate McGonigal, she says, when you move for sustained periods, it gets your hope molecules stimulated. That's what she calls them. She's a physiologist. So she does yoga, get your hope molecules stimulated. And here's some other things that tend to promote uplifting your mood besides counseling and besides running and connecting with people. Singing, writing poetry, dancing, journaling about how you're managing this challenging time. These are all ways of reemphasizing both in your brain and also in your just in your spirit that these are some of your go-tos that help you feel better. One of my, besides working out and meditation, I also sing, and Amber might remember that, but or Allison, not too many people want me to do it, but I always will. And I'll finish up with this one. As a good mindfulness-based cognitive counselor, what's the story that you're telling yourself in your head? Which is basically revising your self-talk. And it's not telling yourself something that's unrealistic. Like unrealistic would be, this is not such a big deal time. Well, this is a big deal time. Something realistic is, I'm going to reach out for the support I need in order to manage my health and my emotional well-being during this time. I will reach out to my higher power or God or whatever, connect with my family, my friends, and find healthy activities, whatever those are that work for me. I will find those, and I will do some of those each day. All right. All right, Tim, back to you, partner. You're muted, Tim.
He's always got my back. Thanks, Shannon. Just wanted to dovetail on one of the things you said. One of our conversations we had a little while ago, we talked about, what good can you make out of this pandemic? What change in yourself as a result of this pandemic can be a good one. And I know you shared with me that you're going to have more time to be able to sit down. And Dr. Hodges, I'm happy to say, is writing a new book to add to his numerous other ones to occupy some of his COVID-related extra time. And one of the things I decided I would do would be to just finally let myself get good with the whole idea of online teaching. And I've realized you can do online teaching, and it can be done well. And it doesn't give me the energy I have when I'm in a classroom with my students that I draw off of, their energy. But I've decided that that's going to be what I'm going to do differently, and I'm going to try to be good at as a result of COVID-19. So I think if we all look at it that way, we can try to turn this into a positive as much as just trying to cope with it as well. So now let's turn to our illustrious panel. They are all 4 of our shining graduates from Niagara University. 3 of them are psychology graduates. I'm very happy to say. I want to bask in a little reflected glory. All 4 of them are graduates of our Master's in Clinical Mental Health Counseling program that we're all very proud of. They've all graduated within the last 5 years from that Master's in Clinical Mental Health Counseling program. And they include Amber Boyer, who graduated in 2015 from her psychology degree program here at Niagara, and then in 2017 from the clinical mental health counseling program. And also Allison Philosophos, who graduated from NU, the undergraduate in 2012, and then the master's program in 2015. And Sabrina Kandai graduated in 2014 from our Master's in Clinical Mental Health program. And Jessica also was one of my psych grads. I think it was about 2010, but I'm not quite sure. But she graduated in 2015 from our Master's in Clinical Mental Health program. So we're going to, and Shannon, do you have anything else to say about these wonderful graduates, or have I covered the ground?
Yeah, you've covered the ground. I would just say they are all very skilled people. Niagara University, both our psych program, clinical mental health counseling program, can be very proud of these people. And in some way, I'll speak for myself on the next. In some ways, I know they have surpassed me. So they're also very, very fine people.
That is truly the bottom line. We did this. We were asked to do this about a month and a half ago. And I just sat there in awe listening to them, and I know you're going to enjoy their comments. So we're going to start with Amber Boyer. Amber, take it away and tell us your thoughts about dealing with the pandemic and what you're seeing out there on the front lines as a licensed clinical mental health counselor.
Thank you. I'm proud to. Thank you so much for the kind words, you guys. I'm so proud to be an alumna of Niagara University, both the programs, and I'm so grateful that you guys are putting this on as part of Mental Health Week at Niagara. This is something I remember as an undergrad and active minds really working hard to try to focus on and talk about the importance of mental health. And now more than ever is the time when we need to keep having these conversations. As a whole world, we're going through this, and there's a component in Self-Compassion by Kristen Neff where she talks about this shared human suffering, and that now more than ever is when we're going through this. And this is a time, I would argue, where it's so important to practice radical acceptance to the degree that this is so uncertain about how we have to change every day and what we have to do, other than knowing that we have to wear our masks in public and practice the physical distancing. Like Dr. Hodges was saying, we don't necessarily have to think of this as social distancing. This can be something where we're able to keep our distance, but still connect with one another. And more importantly, I would argue, connect with ourselves. right now, trying to have that understanding of what we can and can't control, this is something that I've been talking about with my patients for the last 3 years in the field of substance use. So often I have to teach them the ways of, how do you live with an addiction? How do you set boundaries? And these are things that we're doing every day now. One thing that's been staggering to me about this pandemic is that the rates of clinical incident reports have gone up 60% from last year to this year, over 60% by now, I'm sure, with the recent losses that we've experienced in my clinic alone. So incident reports for us include things like Dr. Osberg was referring to: suicide attempts, completions, overdoses, whether accidental or intentional, and sadly client deaths also. Right now, especially at the Bailey Avenue Clinic that I work at for Horizon, we have such limited resources. But what we don't have limited is our thoughts, right? So I'm still trying to reach patients over the phone if they have access to it. But sadly, we don't have as much patient access to things like what we're on right now, Zoom. And these are things I would encourage all of you here now to not take for granted, to understand that these are resources that you have in ways that you can try to utilize the supports that are offered to you, like this panel right now. Some things that I would encourage that I've had to do both personally and professionally are self-monitoring is the biggest one. Trying to take a daily self-reflection like Dr. Hodges was referring to, tuning in and doing a body scan head to toe, figure out where you're feeling this stress and how you can manage it, whether it's by exercising, journaling, just smelling and trying to breathe in flowers or doing the snow, but doing something to bring your mind and your body back to what, again, you can control and what's happening in this present moment. Listening to the supports and the loved ones that you have around you who are pointing out any changes. It's very important to try to listen to those things and take that as constructive feedback and not criticism, especially at a time like right now. And engage in grounding. Whether grounding means lighting your favorite candle or cuddling up with your coziest blanket or your dogs, whatever that means to you, but again, trying to get back into this moment and what you have control over. Another suggestion of strategy for how to manage mental health right now is trying to prioritize yourself, like I was mentioning earlier, and setting boundaries with yourself as well as others. Now is not the time to compare yourself to others or be on social media more than you have to. It's so important to try to create a routine for yourself and take care of what, again, you can control, and just that day-to-day physical activity like Dr. Hodges was referring to, going to your own counseling appointments, knowing your limits and when to say no about, there's too much information on the internet. And lastly, with setting that boundaries, doing things mindfully. And when I say that, I mean not trying to multitask. When you're doing something, do it wholeheartedly. This is a way to try to really just focus on one thing at a time and not feel more anxious or more overwhelmed than we all already are as a society. Be informed and be hopeful. Trying to learn hopefulness is something that everybody can attain. It's a choice in your thinking to decide that today I'm going to be grateful for what I have and what I have control over, and that the family members I do have are safe and healthy. I am safe and healthy. And these daily reflections and the opportunities to practice hopefulness, I know from, again, personal and professional experience, are things that are going to help get you through this pandemic. A couple of resources that I'd like to throw out there as well are myself as a counselor at Horizon, which I'm so proud to be a part of. Our admissions line for anybody who's watching or listening is 716-831-1800. And of course, crisis services if you're in that imminent danger. As we know, it's much more likely now more than ever before. And utilizing the resources closest to you, this panel, your friends, your family, and any supports that you can find on campus, whether it's your counseling services, your local organization, or the rest of what you're going to find in the Mental Health Awareness Week that NU is holding right now. Thank you guys so much for letting me be a part of this. And if you ever need anything, I'm here too.
Well, thank you so much, Amber, for those very, very well thought out comments. I really like that idea of learned hopefulness. That's a new concept for me. I've of course, teach all about learned helplessness, Seligman's concept. And of course, he came up with as one of the fathers of positive psychology, he came up with the concept of learned optimism, but I think we take it a step further with learned hopefulness. So thanks for reminding us of the need to do that as well. I think I'll turn over now to our next panelist, Allison Philosophos. Allison, if you want to take things over now and tell us your thoughts.
All right, thank you very much, Dr. O. I'm very honored to be a part of this. Thank you guys for asking me to do this and be a part of Mental Health Week at NU. It's a big deal. Mental health awareness is everything at this point, I think, in the stage of COVID and the world that we're now living in. You know, I think with everything going on and how difficult it has been for everybody to continuously keep themselves even keeled, I think it's been lacking for a long time. So as far as I'm concerned, when it comes to what I do, I work for BetterHelp, the online telehealth forum for mental health therapy and counseling. I've been doing it since the pandemic started. Ironically, it wasn't supposed to be that way, but it ended up being that way anyways. And I've rolled with it, and it's been keeping me on my toes, keep me very busy. I've been seeing clients from all walks of life, all different countries, different states. That has been a really interesting part of being a part of that platform. As far as the platform goes, I've seen many similar concerns, I guess you can say, all across the board when it comes to client chief complaints, so to speak. So in terms of, you know, the low lows of depression, the high rates of anxiety, and we all kind of are hoping for this to end so that way all of us can be together and safe and healthy all together again. And the timeline keeps getting stretched and stretched and stretched. And it's getting to wear on every person in terms of, can they be around people? As Dr. Hodges mentioned before, you know, people that live alone, they have limited actual physical interaction with other people, and how, you know, mentally exhausting that can be in terms of, am I lonely? Do I feel depressed because I'm not around anybody? Do I have a job? Do I have people that I can go to talk to? I stress a ton of social support within my caseload, the importance of reaching out to people, whether doesn't have to be in a physical setting. It can be something like this, you know, a Zoom meeting, a FaceTime, just a phone call, a text message to say, hey, I'm thinking of you today. Just kind of shows that we aren't alone in these things, and that people are drawn to other people's positivity. So if you're saying, hey, I'm thinking about you today, I've just been thinking of you just because I love you and I miss you and I can't physically see you, but I'm still here for you. That is of the utmost importance, in my opinion, in terms of, you know, getting through this together. We say, oh, we're all in this together, but do we take that a step further and actually say, I'm here for you. You need me, you call, no matter what time. You know, that's a true person that's going to stand there and be in your corner. So I stress that so much with my entire caseload, being there for people and having those people that they can go to. I actually tell them to like write them down, and like write down three of their phone numbers and all their names, so that way you have them readily available. And then a struggle I've had with BetterHelp is like local resources, because I work with people from all over the place. So I've gone an extra mile to say, where do you live? What county do you live in? And I've Googled like their crisis services line or like a local hospital that they can go to, just so that way they have an added layer of support there as well from a professional standpoint, because physically we're not there together having in-person therapy, but there's still other resources and things out there for them. I stress a lot with my clients' routine. Everybody's so thrown off of routine right now. People are home all of the time. If they're not home all the time, they probably want to be home all the time because of the chaos in the world right now. And the importance of getting up, getting out of bed, taking a shower, getting yourself ready, even if it's to sit on Zoom all day. You know, I got ready clearly to be here. I wasn't wearing lipstick all day, you know, with my clients. And so it's important to feel good about yourself and to get ready and to do something that you used to do that was, quote, normal, right? So being able to step out of that bubble and say, okay, I need to take care of me, and get back into a routine, whether it is getting up and taking a shower at 9 a.m. every single day and being consistent with it, because having that consistency will continue along the road, hopefully, to continue it to happen. And then another thing is, of course, with, in terms of therapists and clients, self-care. What does your self-care routine look like? Do you have a self-care routine? Is your self-care routine getting your kids to sleep and finally sitting on the couch and that's all that you do? You know, what is your routine? What do you do for yourself? Do you exercise? Do you journal? Do you meditate? Do you go for walks in the freezing cold? Do you, you know, call your such and such person, friend, whatever, at the same time every day to check in? What do you do to take care of yourself? And a lot of people don't have answers to that, which is probably the place to start in terms of like, well, what do you like to do? And people are like, well, I'm an adult. I don't really have hobbies. I watch TV. And I'm like, well, let's start there. What's something else that we can do to get you feeling good about yourself? So self-care has been a huge thing that I've stressed with my clients as well. And then the last thing I want to touch on is just getting into more of a positive upswing, I guess, and challenging my clients to tell me what that looks like for them. So if you are finding that there's all this negativity out there, what are you doing for yourself what good has come out of this? So for my clients, they've said, well, I haven't reached out for help until now. So I'm like, well, that's a positive. You're taking that step for yourself. You're choosing yourself, and you're choosing to make yourself this newer, better, improved version of who you already are. And you're showing yourself, I'm worth it. I matter. My mental health means something to me. And I've heard from countless clients about, it's really hard for me to go to people when they're all seeming so busy with their own problems in their own lives, even during the era of COVID. I don't feel like people are hearing me. They're listening. They may be like, okay, yeah, okay, I'm over here listening, but I'm really not listening to you. And a lot of my clients have said, I just want to feel heard. And I want to feel like what you are saying, what I'm saying to you matters. And so a lot of validation, a lot of, you know, accepting where you are and understanding that it's okay to feel how you feel, because we're all feeling very similar ways. It's just, we all have different ways of dealing and coping. So those are my few tidbits. I hope that was what you were looking for, Dr. O. And thank you again for asking me to be a part of this. It's a huge honor.
Really enjoyed your comments, Allison. And
Thank you.
I think, you know, part of what you're saying is, and I think there's a truth in there, that we, you know, when we're thinking about whether or not whether other people are thinking about us, we need to remind ourselves they're going through the same thing we are as well. And that whole idea of sense of purpose, I think, is crucial. Have a sense of purpose for each day. And that helps draw you outside of yourself and out of those thoughts that are going to just wallow in, you know, what we're all going through right now. So I really appreciate your comments. I think what I'll do now is I'll turn over the introductions to my colleague, Dr. Hodges, who can introduce our last two illustrious NU graduate presenters.
All right, I'm very happy to do that. We have a couple of more presenters here, of course, and the next one I'm going to talk about is Jessica Whitley. Jessica she graduated in 2015, and she's a senior therapist with Monsignor Carr Institute, among other things that she does, because she also teaches part-time, and she's one of those very, very busy people. So Jessica, we'll go with you next. How about that?
Sounds great. Thank you so much, Dr. Hodges and Dr. Osberg, for letting me be a part of Mental Health Week at Niagara. And thank you also to the Mother Cabrini Foundation for making this possible for us. It's really wonderful that we're able to get together and talk about these things, because they are so important. So one of the things that I have really noticed during this pandemic, I operate from a very trauma-informed standpoint, and I work with a lot of clients who have experienced a lot of really horrible traumas in their lives. And what I'm finding more and more as this pandemic moves onward is that everyday tasks, everyday things, everyday places that we would go have now become traumatic for our clients. I've had clients who have reported going to their doctor's offices and having terrible experiences because they're feeling like they're being looked at as if they're ill when they're not. They've gone in for tests for surgeries and things like that, and they're being poked and prodded in new scary ways. They're being put behind pieces of glass. They're being yelled at by very stressed out staff members who are also having traumatic experiences themselves from dealing with this and having to work in this environment. And one of the things that I hear over and over again from a lot of my clients is, why can't people just be kind to each other? And that has been something that has been truly impactful for me. Just based on the fact that we think of trauma as major events. We think of trauma as things that happen to people who are in combat, as things that happen to people who have been in major accidents, people who have been involved in community violence. But trauma is really anything that is extremely upsetting to us and that really sticks with us. And this is something that is really upsetting to us and is going to really stick with us and have an impact on all of us. And not only do I think that it's something that is traumatic for our clients, but I think it is traumatic for us as practitioners as well. And that's something that we don't stop and look at sometimes. We're not looking at the impact that this is having on us and our colleagues. And I think that that is something that's really important for us as mental health professionals to really stop and take a moment and sit with that fact that we are also experiencing the effects of this, and we have to recognize that this isn't just vicarious trauma that we're experiencing. We are living this ourselves. So we have to take a step back ourselves. We have to, everything that we're talking about in this panel discussion today, we cannot just apply it to our clients. We have to apply it to ourselves. Because if we don't, we're going to be seeing exponential rates of burnout. I think we already are, honestly. I know that the clinicians that I supervise are feeling the effects of this going on, just in the fact that they're talking to their clients about the same exact things that they're anxious about. Their clients are depressed with the same things that they're depressed about. And I shouldn't say I'm part of this too. So I'm guilty of my own mistake that I'm looking at, is that we have to be recognizing that in order to help our clients, we need to be helping ourselves as well. So we need to be mindful of ourselves and what is happening with us. One of the things that I really stress, obviously, on top of all of the things that both Amber and Allison have mentioned are, and also Dr. Hodges and Dr. Osberg, is feeding yourself the right things. So something that I've noticed in myself and my colleagues and my clients is that people are, especially now that the weather has changed, kind of working from this standpoint of, when I don't feel well, I start to eat more, and people are coming into me saying, I'm so hungry all the time, or I'm craving sweets and I'm craving things that are bad for me and I can't seem to stop this. And they kind of think, oh, this is a part of depression. And I say, well, it is too, but it becomes a habit. So working really on improving the things that we put into our body. So I know we were talking a lot before about the positive self-talk and putting those positive thoughts into our brain and being hopeful and putting that positivity into our brain, and exercising so that we're getting our endorphins flowing. And we also have to look at literally the physical things that we're putting into our bodies. So simple things like making sure that we're hydrated enough, because that is going to improve the way that we feel. Making sure that we're eating inflammation reducing foods instead of inflammation increasing foods. I'm really interested in the way that different foods affect our mental health. So I am always a person that's advocating to my clients, make sure that you're eating as many healthy foods as you can. Make sure you're eating berries. Make sure that if you're able to access ginger, that you're having ginger in your diet, whether you get the spice that you can pepper on some of your food, or buying the actual root from the grocery store and slicing it and boiling it in water to have it as tea. So I'm always trying to find simple ways and also affordable ways for our clients, because a lot of us work with very low income clients that don't have the ability to go to the grocery store all the time and buy fresh vegetables, unfortunately. So also we're dealing with people who have lost their jobs. So it's a challenge for individuals to be able to deal with the things that they're dealing with and to be able to keep themselves healthy in ways to combat these traumatic experiences that they're constantly having. So like I said, I'm an advocate of mindfulness. I'm an advocate of exercise. Those are absolutely all things that I tell both my clients and my clinicians to be doing for themselves. But I'm also an advocate of healthy nutrition and just trying to do the little tiny things for yourself that are going to make a big difference for when we are working with our clients and when we're just out in the community and being people all around.
Well, thank you, Jessica, and some really good reminders. I want to just piggyback on a couple of those. And compassion fatigue is a real danger for anybody in a service occupation right now, be that counseling or psychology, nursing, medical field. Somebody who's a frontline person and dealing with upset people who's calling in or coming in or whatever. There's any number of ways. And I also like the piece on diet. I think sometimes that gets missed and whatnot. I'll have to, now my spouse is a big ginger advocate, Jess, so think about that. Before I mention our final panelists, I just want to say I'm thinking about vicarious trauma and compassion fatigue. There's a free assessment that's well validated. It's called the Professional Quality of Life Scale. You can Google it. It's in the public domain, and I know Tim is familiar with it, and the rest of you. I use it in a lot of my presentations, and it's just kind of a good way of monitoring, self-monitoring, and you can do it pre and post and whatnot. So, and the Hudnall Stam, who developed it, gives it away for free and says, just do what you can, just, use it in the way that I have instructed you on the instructions. Okay, our final panelist, she's 2014 graduate of the Clinical Mental Health Counseling program. She's the only one who did not graduate from our fine undergrad psych program, but that's okay, almost okay, since was at that big monolith at the University of Toronto up in our neighbor to the north. And Sabrina Kandi, she's an individual and family therapist at Luminous Community Services in Ajax, Ontario in the Greater Toronto area. So Sabrina, we look forward to, with our other colleagues and panelists, we look forward to you giving us your perspective.
Thank you. Thank you so much, Dr. Hodges and Dr. Osberg, and thanks for having me. I'm so excited to be here tonight and especially grateful to be a part of this discussion during Mental Health Awareness Week at NU. As mentioned, my name is Sabrina and I work as a registered psychotherapist in Ontario, Canada. I work general psychotherapy, seeing clients of all ages, and I also work on an intensive dialectical behavior therapy team with 2 practice sites, one in Toronto, one in Ajax, Ontario. As my colleagues have mentioned so much tonight, it is no surprise that COVID-19 and the virus has totally changed the landscape of our world and how we interact with our world. I wanted to start off just by sharing some things that I have noticed coming up in my sessions with my clients, and again, of all ages. With more of us, having our workplaces, our school, our extracurricular activities turning into an online modality, and with so many of the restrictions taking place for COVID-19, so many of us and our clients as well are finding ourselves spending so much more time with our immediate family. And for a lot of people, that's a blessing. It has created such a bonding experience for so many people. And for other clients, quite the opposite. So for those clients, we're kind of seeing a lot more increase in those interpersonal conflicts and arguments. And that can translate to parent-child conflicts, marital conflicts, as well as sibling conflicts. Something that I've been starting to see more and more, especially within the last couple of weeks as Ontario moves into our second wave of the COVID-19 virus, especially within the Greater Toronto Area, we're seeing this phenomenon of COVID fatigue. So people just being really tired and just like, so tired of following all the restrictions, so tired of doing what we need to do to stay safe and keep others safe. And we're seeing that especially within families. Some family members being really tolerant of the restrictions, other family members not being so tolerant. And that is also creating a lot of conflict that we're seeing right now. Of course, the other thing that we're noticing, especially in older teens, young adults, and adults, is that increased feeling of social isolation and loneliness. No more are the days of those hangouts after work or going to extracurriculars. And not only are clients missing those bigger pieces of social interaction, like with your friends or family, they're also missing those small day-to-day interactions. Seeing your favorite barista at your favorite coffee shop every morning as you're grabbing your coffee before you go to work. All of that adds up to a feeling of social connection, and so many people are missing that right now. With that isolation, it can really lead to the lower mood that we've been talking about tonight, lower feelings of motivation, changing in our sleep and eating patterns, increased substance use, and sometimes may even qualify for a depression diagnosis, and for some, those increased feelings of suicidality. The other thing that's been coming up a lot, not just with my clients, but also with friends and family members, and even with myself, it's this feeling of this universal sense of grief and loss. We are all in like a mourning, whether we're mourning an actual death of a loved one, whether we're mourning the loss of a job or financial security, loss of housing. We're also mourning the loss of expectations of how we thought this year would go. Right? 2020 was supposed to be like this big year, this exciting year. And for so many people, they're missing out on graduations, missing out on holidays they were supposed to take or weddings they were supposed to have. And so many people I talk to professionally and personally just convey this overall sense of grief towards the world that we used to live in. And aside from all of this, I've also been noticing such an increase in feelings of anxiety. And this has been one of the most notable challenges, I would say. Across both clinic sites, this virus has really brought a sense of fear, uncertainty, and unpredictability. And overall, that instability feels like such a loss of control for so many people, as Amber was mentioning earlier. And with that increased anxiety, some people do experience an increase in helplessness, and sometimes that can even translate to more of a depressed mood. Now, I know that all of these are really big challenges, and it's really serious. And at the same time, all hope is not lost. There are ways that we can cope. And so some of the biggest ways that I try to empower my clients to cope with everything that's going on and all of their feelings is to refocus on what they do have control over in their life and to take actions over what they can control. So I want to share some tips on what I kind of talk about with my clients, what I do myself, and what I encourage some of you to do if you'd want to try it, to help cope with our current world. First and foremost, we want to validate ourselves. We want to validate what we're going through. We want to give ourselves a level of understanding. It's okay to feel what we feel about what's going on right now, and there's no one way to feel. Anything makes sense. We are going through a global pandemic. Also, when we validate ourselves, we create some space for change, and we create space for change in how we're choosing to cope. So I hope we can remember that. We also want to start creating a new sense of normal based on our current conditions. So this can look like having a new daily routine. We're already in such a vulnerable time, so we really want to limit our emotional vulnerabilities by ensuring that we're keeping a good sleep routine, good eating routine, keeping up with daily activities, and we're allowing time for physical movement. Another thing to consider is if our daily routine has been disrupted such that we're no longer doing things that bring a sense of mastery and personal accomplishment, such as work or being able to do our hobbies because of the virus, we want to find new ways to build mastery within our days. When we do those things that challenge us and also fulfill us, it really brings a sense of control over our emotions and ourselves, and it also allows us to feel masterful and accomplished. We may also consider a new self-care routine, so just doing anything that makes you feel calm and soothed, anything that you like. It can be as simple as having a cup of tea, that's your favorite tea, or it can be more structured, and it can be like going to yoga, doing a meditation, or practicing relaxation skills. Another important thing is we really want to consider our boundaries right now. So many of us, we're working from home, we are doing school from home, we're living at home. We really want to try to set limits, right? So limits around our work, making sure we're not answering calls at 8 p.m. or emails at 10 p.m. We may also think about practical things like separating our living space and our working space. And we may also have to speak with our family members about having boundaries about how much time we're spending with them versus how much personal time we're having ourselves. And most importantly, boundaries around watching the news. How much of the news are we consuming every day? Because like all my colleagues have talked about today, what we consume, what we think about really affects how we feel. And lastly, accumulating positive experiences. What this means is that we want to fill our day with as many positive and feel good experience and positive emotions as we can. There's so many ways to do this, and it's unique to every single person. What makes you feel good is unique to you, and that's okay. But some things to consider is, of course, staying connected to people, practicing your hobbies and activities, attending church or spiritual groups, even reaching out to crisis line or emotional support lines, basically doing anything that's going to fill your cup back up. And one of my favorite ways to build positive emotions is through gratitude. And so that is like keeping a daily gratitude practice and really being mindful about it, spending 2 to 5 minutes to really sit, close your eyes, take a deep breath, think about and envision, what am I grateful for? What am I thankful for in my life? And that will really help us acknowledge what is going well despite all of the challenges that we are all facing. So thank you so much for having me.
Thank you, Sabrina. And I just want to piggyback and a lot of commonality we've heard from our panelists, which is this is new normal, finding self-elevation, self-compassion, finding ways to stay socially connected, being mindful about our activities, sometimes having to limit maybe the news or something because it gets so overwhelming and we can start to feel a bit hopeless, finding meaning and purpose and etc. I talk a lot about gratitudes myself, so I'm glad to hear that's out there. So just a lot of overlap, so really appreciate it. Kim, what's next? Do we turn it over for questions or what are your thoughts?
Yeah, I just want to thank everyone for their wonderful perspectives. I think we've covered so much ground, so many different ways to look at COVID-19, so many different strategies that we might use to try to help ourselves and our clients through this. I don't know that I see any questions in the chat, but Brittany, do you see any? So what I might just say is it possible to unmute everyone, or if you can unmute yourself if you have a question for one of our panelists, please feel free to jump in. Even though we've covered so many different perspectives and ideas for self-care, maybe someone has a question that hasn't been answered yet. Yeah. Patty, did I see your hand up there?
You did, but let Virginia, she has a question now.
Oh, okay.
Okay.
Hi, can you hear me?
Yes.
Hi, I just had a question. As a leader of many employees, I'm trying to keep it together for their benefit, but I do work with some people that suffer from anxiety and depression. And what advice would you give on how I should check in with them without being too personal, but keeping that in mind? Thank you.
Would one of our panelists like to address that question? Yes, no. Well, I think, did somebody want to jump in?
Jessica.
Jess, go ahead.
Yeah. Sure. So I think probably the most important thing is just making sure that they're aware that you have an open door policy, not pressuring them to talk to you, but at the same time letting them know that if there is something that they feel that they need to talk about, that you are a person that is willing to talk to them. I'm assuming that you have an EAP connected to that you would be able to offer them for counseling services. I would highly recommend if you do have an EAP service connected to your place of employment, that you have the information for that service available to you, like readily available to you, so that you can easily provide it to them if they come to you saying, hey, I'm really, really struggling. Because I find that being able to provide my employees with information as quickly as possible for them when they're kind of willing to talk about it and kind of ready for that help is the most helpful for them. So the two takeaways, definitely just having that open door policy and kind of giving them the knowledge that you're there for them, and having adequate information for them of, here, if you feel like just talking to me isn't enough, this is where you can go.
Yeah, just to add to what Jessica said, Virginia, there also, you mentioned anxiety and depression. There are some great online screening tools that you could, at least promote maybe through signage, flyers in the workplace. There's an organization an event called National Mental Health Screening Day. It's basically of the same website, and you can go on there. There's an online link that you can follow to do a very short screening to screen for anxiety disorders and depression. Our students, as a part of this National Mental Health, or not National, but Niagara Mental Health Week, put those QR codes around in some of the areas, common areas where our students frequent last week to promote taking some of these online screenings to see if you need to follow up and see a mental health professional. So that might be another thing I would add on to what Jessica said. Other questions?
I see Paul has a hand up as well. Paul, if you'd like to unmute and ask your question.
Sure. First of all, Tim, I'd like to commend you for taking such a positive approach to teaching online. I've gotten good at it.
What else can you do?
What's that?
I was going to say, what else can you do? You can either cry or try to be happy about it.
Yeah. So I've gotten good at it, but I'm not liking it. But I wanted to ask our panelists, for those of you that were seeing clients face-to-face who are now seeing clients virtually, what changes or differences have you seen both for yourself and for your clients by having your sessions via video conferencing?
I'll go. I'll say something. So I went from working in a substance abuse facility before I had my son last November, face-to-face, people constantly coming in and out of the doors for groups, for individual sessions. Anybody could walk in at any moment. We've had parole officers, police officers, all of that stuff. So it was a very high volume, high, fast-paced type of environment. And then I went out on maternity leave. And then when I left that job and I started with BetterHelp, it was like a full 360. Like the whole, everything just like slowed incredibly down, like way down to the point that I was like, what do I do? Like it was a very weird feeling. And the differences I've noticed as far as, I feel like obviously like with even like what I wear is so much different. Like I don't put dress pants on to sit in my office. Like I'm wearing leggings, because like no one can see me. They see me from here up. And especially if it's like a phone, they literally don't see me. So like, there's chances I'm not wearing makeup, or there's chances that I'm sitting here in like a sweatshirt talking to you, but like, you don't know that because you don't physically see me. So that's obviously some differences as far as like, it seems like it's harder to reach people at times. When you're in person, face-to-face with somebody, you feed off of their energy, their body language. They can tell how you're sitting. I remember going back to like, my first year, I want to say, of graduate school, and Dr. Hodges was talking about just like how important your posture is, and like you're sitting upright and your legs are on the floor, and like you're not fidgety and you're not always moving. And that's so different when it comes to telehealth in the world of, Zoom and phone calls. So I've just noticed people are much more lax, I guess, and it's not so like formal in a way, which isn't really necessarily a bad thing in my opinion. I think the more relaxed you are, the more open you are to therapy, and the more that you are willing to kind of work on yourself. And a lot of people have said to me, well, it's really nice to do this in the comfort of my own home. I'm much more relaxed and I feel like I can be like myself more, and I can be like my truest form. And if you see me and I see my therapist on a video and I'm not wearing makeup, or meaning the client, they are much more relaxed and they don't feel like they have to put on anything for anybody, and they can just be themselves. So that's kind of been a positive takeaway from that.
Okay, thanks, Allison. Looks like we're down to about 5 minutes. We might have time for another question or two. Does someone else want to pose a question for the panel? Going once, going twice. Well, I just want to thank the panel, and we got one question in just before the wire. Patty.
Okay, thank you. I just want to thank Dr. Osberg and Dr. Hodges for putting this together, facilitating this tonight. And I want to thank our panel, Allison, Sabrina, Jessica, excuse me, and Amber. This has really been great. You know, Dr. Osberg mentioned earlier about the events we've had going on this week, but this is thanks to the Mother Cabrini Health Foundation, a grant we received from them. That recognized 3 big things that we were able to accomplish this year with this grant. One being the lack of professionals in Niagara County to treat children in a timely manner with mental and behavioral needs. So we've been able to really train almost 40 professionals in mental health counseling, applied behavior analysis, early childhood special education, and a lot with parent-child interaction therapy. They'll work to a micro-credential in that. We've been able, again, as Dr. Osberg mentioned, we're hoping to have almost 200 on-campus people trained by the end of this week in different sessions, between awareness, a gatekeeper session, a 6-hour session where they get a little bit more familiar. And then we'll have actually 16 instructors that will receive 3-day training in December, so they can become our Train the Trainers and continue with on-campus support, hopefully for years to come. So this has really, again, been a great panel, very informative, but we're really pleased that we'll be able, through this grant, to really move forward so many things that really need to be done in the areas of mental and behavioral health. So thank you again, and thank you for everyone for joining tonight.
Well, thanks for those kind words, Patty. And again, I just want to thank you for your tireless efforts to put all of this week's activities together and administer this grant. I just want to point out that I did sign up for my training on the website, and the price for the instructor package was $10,000. I'm not kidding you. So really? I hope they didn't overcharge me. But I had a coupon code that brought it down to 0. So, but anyway.
Wow.
It's a great grant. It's really going to make Niagara University community a community that's going to be very mental health literate. Mm-hmm. And I think it'll be an important event, an important week, and an important grant for years going forward. So thanks again to everybody for being here. Thanks to our attendees for coming and listening. And again, let's go forward and let's do the best we can to try to keep our mental health during these trying times.
Right. Thank you, everyone.
Take care. Good night.
Good night.